Now to the coronavirus pandemic. Wisconsin state officials have released the latest information about positive cases. Here is the map of our region. Milwaukee County still has the most positive cases in our area. There are 638 new cases reported today across the state, with a total of more than 71,000 positive cases since the pandemic started in mid-March. Also out today, deaths have also increased by 13. And our 7-day average of positive cases still sitting at 8% today. Local and state officials have said in the past they want that number to be near 5%. Dr. Jeff Potoff from UW Health is with us again to talk about the COVID-19 pandemic. And doctor, thank you very much for joining us. How would you describe our current situation, especially as so many parents are talking about sending their kids back to school, as we're going to see kids go back to college? What's the situation right now?
Yeah, we're still not out of the woods with COVID-19. Now, with the mask mandate, we have seen a little bit of leveling off of COVID-19 numbers. In some areas, there's been a fair bit of a decrease, but there's still a lot of cases out there and there's still a lot of transmission. And I think it's on all of our minds, what's going to happen with these college campuses. We've seen other parts of the country open up before us as far as the campuses, and it hasn't always gone so well. So I think all eyes are on those campuses and on those young adults to see how this works out in Wisconsin.
So when you see us trending at 8%, why is 5% the better number?
Yeah, you want to get down to a lower number for two reasons. One, it would indicate that there's less people that are able to transmit it in the community. That makes our communities a safer place. Secondarily, the less number of people who are testing positive, the easier it is for contact tracers to follow up with those people, to find out who their contacts were, and really try to suppress this virus. Once you have a high rate of positivity, it gets to be logistically very difficult for those contact tracers to find everyone who is positive.
So where are we today when we talk about cures? I know we're still waiting for the vaccine, but what tools are you able to use right now? And President Trump talking more about this as well. Where are we in that area in terms of vaccine and trials?
We have a few tools. So dexamethasone is a helpful corticosteroid in the fight of COVID-19. Remdesivir is an antiviral that's showing promise. You heard more about convalescent plasma. It was hyped up maybe a little bit more than what the reality is, but it's showing promise. It's looking like it's safe. It's looking like it might be able to make a difference. I think we need a little bit more robust studies on that. And those are kind of the treatments that are really showing some promise in the battle against COVID-19. None of them a miracle cure, but promise. And vaccines seem to be making progress. Phase 3 trials, manufacturers ramping up production. It's on track. We just have to make sure that we don't get a little too overeager to have a vaccine and approve something that we don't know for sure is safe and effective.
Dr. Potoff, we appreciate you walking us through today's developments and where we are as the state. Thank you for your time.